Hi guys, this is Dhananjay here and I am here to tell you something about this special program called Integrated American Program at University of Georgia. And MOKSH is the only one which has brought this exclusive program for all Indian students. A lot of students are asking us questions, sir, how will we do the entire program right up to PG in USA? While I am starting my MBBS in Georgia, how can I ensure that I will reach to the PG in USA? So guys, this is one video which will explain you what are you going to get in this integrated American program at University of Georgia. So guys, this is a normal 6-year program in Georgia, okay, which is standard MBBS program, okay. Along with this program, you are going to get lot of American modules which are based on patient-centered learning. So standard MBBS program will be coupled with American modules which are slightly above the standard level, because the normal standard program is much more theoretical, but theoretical doctors are of no use in this world. Everything has to be learned from the patients. You know, the patient-centered learning is the key word for the medical education right now. So there will be a specific available center. It's called a career center inside the University of Georgia, which will constantly make you adaptive to the American system. Okay, this is the additional module that you will get into American model, because a standard program will, just barely give you theory. Even you will need the next preparation, because that is MCQ based, right? You will need some application. But USMLE, your education is even further one. Step 1 and step 2 are the two CK are the two examinations. You will be prepared for step 1 examination so that you can give it between 3rd year and 4th year, okay? And you will be giving 2 CK, preparing for the 2 CK examination, USMLE 2 CK examination in the between 5th and 6th year. So by the time you graduate, you will be ready with the scores of step 1 and 2 CK. Believe me, University of Georgia is so strict and the American modules are so fundamentally, concretized into the program that every student, unless and until they are ready for step 1, preparation for 240, of course the results will be for pass or fail, but remember your preparation should be 240, and 2 CK again preparation for 240, then only you can expect to get into. And here the integrated American program comes with a guarantee of these scores. Unless and until you are ready for that score, you will not be allowed to register for the examination, because it's quite an expensive affair to register for an exam, and you will get only one chance for step 1 and 2 CK, okay? So we will make sure there will be mentors who will tell you exactly when you are getting ready. This step 1 and 2 CK preparation will be in 4 phases: preparatory, consolidation, revision and precision. This is the stage at which you reach 240. Generally, when you start the preparation along with the standard program, you are at 194. That is the passing mark in USMLE. By the time 3.5 years goes, you will be ready for 240 for step 1 and another 2 years of program. And this whole program will be live lectures, live mentoring, offline support for progressive tracking. That is the most important thing. Ideal way to learn and prepare for USMLE is to identify weaknesses and make sure that you talk to the doctor, sit with him, remove those weaknesses, again get yourself reassessed. You will be given test modules. You will have to continuously give those test modules. The entire standard MBBS program is imbibed along with the American program. Both will go hand in hand, and you will be prepared for step 1 and your CV needs to be built before you can apply for residency in USA. So residency means the program which leads to post-graduation. You work as a resident doctor in the USA and you earn 1.5 crore, 45 lakhs per year approximately. While you do PG, आपको सबको पता है इंडिया में if you want to become a postgraduate, you have to pay 1.5 crore. In US, there is no such fees. So actually, it's the most economical program if you want to become a specialist, because in India this itself will cost you 80 lakhs, this will cost you 1.5 crore. In University of Georgia this will cost you approximately 60 lakhs including hostel, food, everything. This you will earn 1.5 crore. But if you apply for scholarship here, which is worth around 15 lakhs, even that will come down to around 40 to 45 lakhs. So that is why this program has become one of the rage. So what has happened, the moment MOKSH launched University of Georgia integrated American program, इंडिया का हर एजेंट बोले हाँ ये यूनिवर्सिटी में भी अमेरिकन लाओ $1,000. अरे भाई मुझे आई विल शो यू द एडमिशन लेटर ऑफ यूनिवर्सिटी ऑफ जॉर्जिया इन माय नेक्स्ट वीडियो. यू विल गेट zapped. The university is giving complete commitment. So whenever any agent tells you this is an American program, tell him, does it have USMLE preparation? Does it have 800 hours of live lecture? Does it have American modules imbibed? लिख के दो भाई, मुंह जबानी नहीं चलेगा. सब कुछ यूनिवर्सिटी के लेटरहेड पे लिख के दो. Unless university writes it as an American MD program, integrated American program, right up to PG in USA, these agents will take money out of your pocket and put you in a trouble. This entire program is right up to 2CK. Not only that, I am on a public video, I am telling you this very clearly. You need to do clerkship in USA before you can get PG. So here you can see that gap. That is when you do your clerkship. Just within your internship period, you will do your clerkship. In US, MOKSH takes entire responsibility when it places in American program. You will not only be doing your MBBS, you will also be preparing for step 1 and 2CK. You will also be getting an American module and a doctor over there in the career center to ensure that you are reaching right up to post-graduation. This is the basis of entire test platform with thousands of question banks. The whole program runs on a day-to-day basis with a live lecture of more than 850 hours by the global faculty to prepare you for the USMLE exams. 6 साल में इंश्योर करो कि अपने पेरेंट्स को वापस आप 1.5 करोड़ मांगने नहीं निकलोगे. ठीक है, आप ये इंश्योर करो कि मुझे सिर्फ डॉक्टर नहीं बनना, आई वांट टू गो राइट अप टू पीजी. आप ये इंश्योर करो कि मेरे को अपना करियर पाथ बहुत ही क्लियर है. अगर मैं जॉर्जिया जाऊंगा तो मैं वो छोटे छोटे फालतू कॉलेजेस में, प्राइवेट कॉलेज में नहीं जाना. मुझे ये इंटीग्रेटेड अमेरिकन प्रोग्राम सिर्फ 2 ही कॉलेजेस में जेन्युइनली रन कर रहा है. एक है TSMU, एक है यूनिवर्सिटी ऑफ जॉर्जिया. None of the other colleges have this kind of a program. And I will tell you, I am going to put up more videos how to select a university in Georgia. What are the things that you should tick mark before you select? You should ask your agent, consultant, whatever you may call him, कि भाई ये है लिख के दो, ये है लिख के दो तो ही मैं जाऊंगा, नहीं तो नहीं जाऊंगा. That is the video which you should look for in my next video is about how to select a university in Georgia, because 21 कॉलेजेस हैं, 16 प्राइवेट हैं, 14 बकवास हैं. भाई 35 लाख का पॉपुलेशन है, 11 लाख का पॉपुलेशन तिबलिसी में है. कहाँ से पेशेंट्स निकालोगे? जो सबसे बड़ा, द बिगेस्ट हॉस्पिटल व्हाट यू हैव इज न्यू हॉस्पिटल इन तिबलिसी which is affiliated with University of Georgia. And that is the reason why we selected the best one, the best program and the right country for you to be in. Thank you guys.